Okay, with that, I'm really excited to introduce our next speaker. Laura Kate Bender is the National Assistant Vice President for Healthy Air, American Lung Association. It has been an incredible year with tons of opportunities for health professionals to leverage their voice, and the ALA has really helped mobilize the health professional voice in the space. So Laura Kate's going to tell us about federal climate policy.
Hi, everyone. Is my mic on? Yes? No? They hooked me up. Okay. How about now? Hi. Hope everybody's doing well. Thank you for the stretch break. That was great. I'm going to take a few minutes today, and I'll leave lots of time for questions at the end, to talk about a couple of Lung Association resources. If you have heard me talk here previously, these will sound familiar. I promise. I'll keep highlighting them until you tell me that they're not useful anymore, and then we'll make new ones. I'll talk a little bit about the National Health Organization coalition engagement that we've seen over the past year, in hopes that it's also useful to apply at the state level. And I'm also going to highlight a few key federal regulations that we all have been working on, a couple that are now crossed off the to-do list and some that are very much on it. And that'll be especially relevant for those of you who are making visits to Capitol Hill tomorrow. So first resource, you likely all already know this, so thank you for bearing with me, but the Lung Association's State of the Air report provides an annual look at air quality that we hope is useful to tell the story about air pollution where you live. So the quick recap, we do this every year. We take the Environmental Protection Agency's official air quality data from monitors across the country, and we use it to assign letter grades to counties and rankings for cities for their levels of air pollution. We look at two pollutants, particle pollution or soot, and ozone pollution or smog. We have the top 10 dirtiest for each pollutant. We have the cleanest cities. And in addition to letter grades for communities across the country, we also have for every county, whether or not you have an air pollution monitor there, we have tallies of who's at risk. So population estimates of kids with asthma, people with COPD, new lung cancer cases, basically to help you tell the story of the impact of air pollution on your community. So lung.org/SOTA is the website. You can use it, again, for your Hill visits tomorrow or for any advocacy that you're doing to help paint a picture of the quality of the air in your community, your member of Congress's district, et cetera. I'll also give a quick preview. As I mentioned, this is an annual report. The next report is coming out on April 24th of this year. We'll be back in touch with lots more information, but we used 3 most recent quality assured air quality data years. This year will be the first time that all of those years have been post 2020. So it's 2020, 2021, and 2022. So it's a couple years back, but it'll be the current quality assured data to paint the latest picture of the quality of the air that everyone is breathing. The other resource, and that folks have been asking about on the tables out there that I'll highlight today, is our series of electric vehicles reports. These are all available at lung.org/EV. A couple years ago, the Lung Association worked with an outside firm to do some modeling, and we looked at the impact to health of a zero-emission future. So we looked at a future in which all of our new cars being sold are zero-emission vehicles by 2035. All of our new vans, trucks, and buses being sold are zero-emission vehicles by 2040. And then because clean vehicles are only half of the puzzle, if they're being powered by dirty electricity, we won't get all these health benefits. We also modeled a future where there is 100% clean electricity generation by 2035. We picked that number because it's what the Biden administration said their goal was. And then for the Lung Association, I'll note that for us, clean means not burning stuff. So that is wind and solar, not biomass. The data that we pulled from that, we've now used for 3 and soon to be 4 reports. And again, those are all available at lung.org/EV. We added up the health benefits over 30 years, and we found that this transition will cause some pretty staggering health harms to be avoided. So if you assign a dollar figure to the health harms avoided from that transition, it's worth $1.2 trillion over 30 years. It saves 110,000 lives. And what we've done is we've released 3 separate reports that crunch those numbers a little bit differently. The first, zeroing in on healthy air, has the big top line number that I just mentioned. We also have state-by-state totals, as well as totals for many metro areas, again, in case that is useful to plug into your advocacy efforts. We did a report called the driving to clean air, which looks at the light duty side. So if we have clean cars and electricity, what is the share of the benefits that we'll see? We looked at delivering clean air, which is trucks. So we took the trucks numbers, specifically focused on communities that have heavy truck traffic and crunched those health benefits numbers. And then actually next week on February 21st, we're releasing a fourth report in this series. It's called Boosting Health for Children, and we're going to pull out the pediatric health impacts. So again, all of these assumptions, zero emission future when it comes to our transportation and our electricity, and what are the health harms to kids that that transition will avoid. Again, all of these are available at lung.org/EV. They have, generally speaking, there are top 10 lists or greater about the different state level health impacts in case that is helpful to plug in for your advocacy. And I'll also note that if you ever need something that's not in the report, we have a lot of underlying data. Let us know and we might be able to help you find it in there. Okay, so I said I would talk a little bit about health coalitions, what we have been up to at the national level. And I'll start by saying, so obviously this is foundational to the consortium, the idea of working in coalition among health organizations, specifically medical societies. For the Lung Association, it's really important to us too. We work closely with the consortium, and then we work closely with a broader coalition of national health and medical, public health, nursing, health orgs to advocate for clean air and climate policy at the federal level. So I'll speak to federal and national today. I'm certainly not claiming to speak for every health organization, but these are some examples of what's worked for us. So first off, why do we work in coalition? Well, one, more credibility. I have the story that I always turn to for this is there was a really terrible bill that would have weakened the Clean Air Act that was getting a hearing in the Senate. And we, as we often do, had submitted a letter from multiple health and medical organizations to the senators ahead of the hearing. So Senator Barbara Boxer, who was chairing the committee or sub-chair of the committee at the time, waved the letter up and said, the American Lung Association says that this bill, if passed, will have, this many harms to kids' health. And the lead sponsor of the bill, who was not on our side, said, well, that's the American Lung Association. Do you seriously mean to tell me that this bill is bad just because they say so? And she said, well, if I look at this letter, I also see the American Academy of Pediatrics, the American Thoracic Society, and just listed all the orgs in the letter, a perfect illustration of why coalitions are valuable. It's a lot harder to argue with all of us. More expertise. We are, of course, the Lung Association. We are not the experts on other parts of the body. We rely on our coalition partners to help us with that. And it's critical to painting a full picture of the impacts of air quality and climate change issues. We've also found that when it comes to recruiting health voices, which I imagine you all have found as you've worked within your own institutions and communities, speaking the language of public health helps get more health groups on board. So we've found strength in numbers there. And then finally, the phrase we use to describe this is motherhood and apple pie around the Lung Association. Like, who is going to argue with a child getting fewer asthma attacks? The answer, as it turns out, is plenty of people, but we think it's harder to argue with. Harder to argue with than other values. So this slide is just an example. The way we run our coalition at the Lung Association is we have lots of groups get engaged with us. Every individual thing that we do, we let people opt into signing on to. So this is just one snapshot. On the left, there's a bunch of examples of some national groups that we work with. Many of you are represented in the room. Thank you. And on the right is an example of a state level letter, because while I work on the national level, a lot of your chapters and a lot of other public health organizations that we work with are very active across various states. And so there's always an opportunity to do what we do at the national level at the state level as well. So I'll talk a little bit here about tactics, and then what I'll do is I'll go through a few key federal clean air and climate rules from the past year or so, and give a couple more examples of tactics that we've used for each of those. So most recently, and many of you again in the room have done these with me, thank you. We have been meeting with the White House Office of Management and Budget. This gets very wonky very quickly, but essentially every time EPA or another federal agency is working on getting a clean air or climate reg across the finish line, finalizing a new regulation, one of the key steps in the process is review by the White House Office of Management and Budget. They have a key office there that does regulatory review. It's a bit of a black box, but it is a key chance to influence regulations because oftentimes While we might shout ourselves hoarse at EPA, at the end of the day, the White House is going to make a political and maybe even a budgetary decision about whether to let a final rule get out across the finish line. And so this is a key place that the Lung Association and many of you have been weighing in favor of regulations getting finalized. Of course, these are EPA rules that we're pushing for, and I'll highlight them in a minute. So we had a couple chances to meet virtually with EPA Administrator Regan, as well as other officials at EPA. And then, as I mentioned, there are all kinds of opportunities at the federal level for public participation. Typically, each big regulation that gets proposed has a formal comment period. Anyone can submit comments. Anyone should submit comments. They often hold a virtual public hearing. They are required to weight comments the same, whether you submit them in writing or whether you say them at their virtual hearing. We like to do both because your comments can be longer in writing than they can be in person or out loud, but also a lot of times there are reporters in the room for the hearings. So they're both great opportunities to weigh in. We've written plenty of letters to key administration officials, also to Congress, more on that later. And I'll mention media advocacy. You all know well the role that health and specifically medical voices can play in highlighting these issues to the media. As a coalition, we've been working to do that more than ever. We've worked to have a couple of media roundtables with key health voices, many virtual press conferences after key rules have come out. We've worked with some of you on op-eds and letters to the editor. And we've worked to pitch key air pollution stories to make sure that reporters understand the background when we're waiting for a final rule to come out. So occasionally we do ads. I will show you an example shortly. And then, of course, congressional education. As you will hear lots more about this evening and tomorrow if you're going on the Hill visits, even when we don't have a specific lobbying ask, even when we're not pushing for or against a specific bill, educating Congress about the administration regulations that we care about is really important because Congress has the power to stop them if they want to. So recently, and by recently I mean the past several months, we've been increasingly aware that it is crunch time for the administration. There are several big things on the Biden administration's to-do list and our to-do list for them that relate to clean air and climate protections. And there's a very tight timeline to get them done. And I didn't put this in the slide on writing, but I will say it here. This is not the top line media message that I give, but essentially there is a ticking clock when it looks like there could be in an election year. If the White House were to change hands, there is the potential that an unfriendly Congress could have an easier pathway to undoing some federal regulations. I'm happy to answer questions after. I won't dive into too much now, but essentially it's called the Congressional Review Act. It's a law that allows Congress to pass resolutions that overturn federal regulations. As you saw highlighted earlier in the presentation, that was one of the rules that they scored. And normally the president would veto such a resolution because obviously a president's not going to be thrilled to overturn something he just finalized. But there's a window of time right after someone new would take office. So if the other party were to take office, there'd be a window of time where they could more easily overturn regs from the previous administration. The clock starts ticking, we think, in April. There's basically a window of time where it's easier to pass these in the Senate in a way that would make them more likely to succeed. So essentially what we did was work backwards, we and everybody else working on these regs, to say, okay, you really need to get everything out the door by April in order to safely avoid the window in which this might be vulnerable to being overturned if the White House changes hands. Again, that's not our front-facing media message when we want to get this stuff done quickly for a lot of obvious reasons. Most importantly, first and foremost, we need to do this stuff because it's going to save people's lives and protect their health. But internally, there is a lot of reason to get it done in the next couple months. So we figured it would help to roll everything up in one. So we have a to-do list that we called Don't Delay Clean Air Today, a menu of things that I will highlight most of in just a moment. Many of you have also been in touch with the Climate Action Campaign about their Solutions for Pollution effort. These are in coordination with each other and very closely dovetailed. So almost everything that's on our list is on the Solutions for Pollution list. And the only difference is because there's a couple Solutions for Pollution regs that are outside of the Lung Association scope, not because we don't like them. There's just, for example, a water issue. But so we decided, whichever way you look at it, that it was helpful to package up the to-do list for the administration, message everything together, and to say after each victory, great that you got this done. Now here's the rest of your to-do list. or to just make sure that we're tying all the regs together whenever we can, so that it's very clear that there's not pick and choose here. They need to get everything done, because truly, when you look at the list, there's nothing that we felt comfortable saying, yep, you can drop that one off. That one's not a big deal. This is the big deal list, and they need to do all of it. Okay, so what are they? So first I'll do the 2 victories. Late last year, EPA finalized new standards limiting methane from the oil and gas industry. Many of you worked on this. I would like to give a special shout out to Physicians for Social Responsibility, whose expertise we very heavily relied on this work. This has been years and years in the making, but what they finalized are stronger limits from emissions from future oil and gas operations, and the first ever limits for existing oil and gas operations. They didn't do everything. They're not a perfect solution, but they're a huge step forward. We care about this because, number one, methane is a potent greenhouse gas, major climate polluter. And number two, emitted alongside methane are volatile organic compounds, dangerous emissions that can have a host of health impacts, everything from immediate cancer risk and reproductive harm, all the way to forming ozone pollution and other downwind pollutants. So I think just to give an example of the coalition's work here again, PSR's leadership was critical. Everything from public comments to public hearings to letters to the White House to EPA, media and public education, and then media response afterward. But this was a big win, and we celebrated it as such. So that was one item crossed off the to-do list. The other item we crossed off the to-do list just last week, the reason my slides were late turning into the consortium, were final soot standards. So the Lung Association and many of you in the room have long argued for stronger national limits on air pollution. EPA, under the Clean Air Act, sets stronger limits on 6 pollutants that are based on public health. So the national limit has to be what the science says is healthy. One of those pollutants is particle pollution, or soot. And we have been saying for years, as have many of you, that the national limit on soot was way too weak, that it did not match what the science says is healthy. After many years of both advocacy and a lawsuit from the previous administration that we joined many of you in suing over, we finally got a stronger national limit on soot. I'll say a couple of things here. Number one, it's a big step forward. It went from 12 to 9 micrograms per cubic meter, which I understand, again, not obvious that that's a big deal, but it is a really big deal. It's a significant tightening of the standard. It was not as strong as we wanted, and it probably as many of your organizations wanted. We pushed for 8 instead of 9, and we also pushed for them to tighten the spikes in the air pollution limit, which we did not get. But all that said, even though we didn't get everything we called for, this is a big deal. I'll also note that number one, the air quality index now gets updated accordingly. So the severe maroon, red, purple colors that you likely advise your patients with is getting tweaked so that it better reflects the science. So for example, it'll now take less pollution to go from green to yellow and less pollution to go from red to maroon. Again, based on EPA's review of the science, which we supported. And then again, while we did not get everything we wanted, EPA estimates that the first year that pretty much all communities, most communities will get their PM levels down to 9 micrograms per cubic meter, it'll prevent 4,500 premature deaths and a host of other health harms. Oh, and I mentioned I would talk more about the ad. That ad up there is an ad. The Lung Association worked with the Climate Action Campaign and several of you in the room to get in a key DC publication to help get the standards over the finish line. Okay, so now over to what they still have left to do. I'll highlight 4 rules here. And again, those of you that are doing the Hill Visits training tonight will hear about this a little bit more. There will be a lot of, this will be relevant for later. Okay, so number 1, trucks. Right now, the nation has standards in place, as you would imagine, that clean up heavy-duty vehicles. So this includes tractor-trailer trucks, city and school buses, any type of bigger vehicle on the roads. Doesn't cover non-road vehicles like construction equipment. EPA is currently, we hope, close to finalizing stronger standards on the next several years of trucks. So basically, starting in model year 2027, so trucks released a few years from now, all the way out through model year 2032, there will be stronger emissions limits required for these trucks. These will be carbon pollution limits, so they will drive down greenhouse gases. What we think that means is that we'll see more zero emission electric vehicles in the heavy duty sector on the road at the same time. And so that even though the standards are about carbon pollution, we'll also see reductions in other pollutants. Some examples of vehicles covered, everything from, like I said, tractor trailers to different types of buses, to garbage and recycling trucks, delivery trucks. I think what I'll note here is that these standards they're a challenge. This is always a question of, what do you accept? Is this strong enough? Do we want to push for stronger? In this case, the Lung Association really wants to see these across the finish line. We think that they're pretty good, that they'll have a lot of health benefits. And strategically speaking, this is what we're going to get if we're going to get anything. This has been one, which I'll be super frank, which some groups want to see much more on. These standards will not, immediately drive a transition to zero emission heavy duty vehicles, but they will help us get there. And so we're happy about it. This has been one that's been a little tricky because some groups are in different spots, but I'm happy to talk more about that after the fact. But I will note, we think that the benefits are big enough here for health that it's definitely worth getting across the finish line. Next, cars, stronger, cleaner car standards. So much like with trucks, we have existing standards for cars. So this is light and medium duty vehicles. So both cars and SUVs, light pickup trucks, and then a medium duty vehicle might be like a post office truck. The current standards are pretty good. These would be better. These would kick in when those current standards end in 2026 and make the next several years of vehicles less polluting. These are not just carbon pollution, but also other pollution. We're really excited about that because it would effectively, if the standards get finalized as they were proposed, effectively require filters, particulate filters on gas-powered vehicles in a way that would really have health benefits. So again, we expect that the standards will help get more zero-emission vehicles on the road. Obviously, that's what we want. I should say what Lung wants. But it would also, knowing that we'll still have many more years of gas vehicles coming off the assembly line, this will help make them cleaner. So again, this rule would have major health benefits. Both this rule and the trucks rule are under final review at the Office of Management and Budget, as I mentioned earlier. We and many of you have made our last pitch to them to make them as strong as possible. And we're continuing to do social media ads around the need to get these strong standards across the finish line. In fact, that'll be the ask for a report coming out next week. Two more, and then I'll pause for questions. So second to last is updated mercury and air toxic standards for the power sector. So right now, there are limits on mercury and air toxics from largely coal-fired power plants, and they've been a huge success story. These limits have been fully implemented, fully enforced. Every power plant that's going to make a change has made a change. Some have closed, some have installed more pollution control technology, and they've reduced emissions by, I think, around 89% from the power sector. So these are highly successful regulations. However, there is still too much mercury and other air toxics being emitted from coal-fired power plants. So EPA is hopefully close to finalizing limits to ratchet down on some of those pollutants a little bit further. So these, again, there are existing limits in place. These would tighten them. So what we hope to see is that lignite coal, which is a particularly dirty form of coal, would have, for the first time, standards on par with other types of coal. It would tighten the standards for hazardous metals besides mercury. And it would also put in place, we hope, to see finalized new monitoring requirements that would better inform the public and also require cleanup when pollution levels are exceeding what's safe. This one, again, we've wrapped public comments. Health orgs have weighed in. This is a great unifier because of, obviously, the health impacts of mercury are far-reaching, but being able, in particular, to highlight the health impact to babies and kids means that sometimes these standards get a little bit more bipartisan support than the others might. We hope to see these finalized very soon, and we hope to see them strong. And then finally, carbon pollution standards for power plants. This one has some backstory, bear with me. So right now, there is no limit to the amount of carbon pollution that a power plant currently running can emit. The Obama administration tried to change that with the finalization of the Clean Power Plan. That rule would have required states to reduce the carbon emissions from their power sector through a variety of ways. They could switch to clean electricity, they could work to reduce demand out in the community. They had a bunch of tools in the toolbox in that plan. That plan got stayed by the Supreme Court, tied up in court. And then when the Trump administration came in, they replaced that with a different rule, the Affordable Clean Energy Rule. That basically would have been worse than nothing. It actually could have caused more emissions. And it was not an answer to the question of what do we do about climate change from the power sector. Again, the Lung Association, many of you sued over that. And that actually culminated in the case that many of you might have heard of, West Virginia versus EPA. This is a case that we did not win. This case effectively ruled that what the Obama administration had done with their regulation was too far, and that EPA could not reduce carbon emissions from power plants by reducing demand in the community or by switching to clean energy. They were only limited effectively to requiring things that the power plants themselves could do within their boundaries. You'll hear it called inside the fence line. So like, yes, you can have a standard that requires effectively power plants to, install technology or be more efficient, but you cannot require states to switch to clean electricity. This really tied EPA's hands. We knew they needed to write a new rule to replace the Clean Power Plan and the Trump era rule. EPA has to clean up greenhouse gases. It is under the Clean Air Act, there's been a process that's found that it is their job because these obviously greenhouse gases affect health, and that's EPA's mandate. So they have to do something. So what they proposed are new carbon pollution standards for power plants that we hope are close to being finalized. For those of you who were here yesterday, as you heard, these have been really tricky. The standards cannot legally do everything that at least we at the Lung Association would like to see them do. EPA's hands, again, are very tied. So what we did in the coalition, at least, knowing that, for Lung and for other organizations, that we didn't have the option of getting what we wanted, and we wanted to see how much we could get from this rule. We worked hard to bring in experts. We had presentations on, what are some of the technologies that would be required? How would this work? And we ended up writing comments that you see here that we hope basically allowed enough nuance into the conversation to say, hey, the standards that you've proposed would require technologies that we're not thrilled about, that have some health downsides. At the same time, it's critical that you reduce carbon emissions. It's critical that you do so from the power sector. Here are some ways that we want to see you take steps to maximize the public health benefit and minimize environmental justice harms. Ideally, this would be addressing environmental justice in an improving way. But we did say, it's good that you're doing this. Here are some ways that you can safeguard health in doing so. I know not every org is in the same place on that. For us, where we came to, again, was nuanced comments that said, this is the right direction, understanding that you can't give us what we actually want because the Supreme Court said no. Here are the comments from the health community that we're willing to sign on about how you can do this in a way that best protects health, understanding the limitations. So we got, I think, more than 100 health orgs on those final comments across national and state. EPA is now, again, hopefully soon, going to finalize those rules. So what we hope to see, we hope to see them across the finish line. And again, I know that not everyone is in the same place on this across the broader environmental community, but we want to see them across the finish line, and we hope to see that they have included as many safeguards as possible so that as plants are installing technology or as technology is getting built out to reduce emissions, that it's not doing so by adding to the pollution burden of the communities around them. Okay, I think that I now have 12 minutes to answer any questions.
Yeah, that was a great presentation. I'm wondering, with all this talk about the EPA and West Virginia versus EPA, what your take is on the challenge to the Chevron doctrine brought by the fishermen that are, my understanding of that is they're required to pay for federal monitors to go on their fishing boats, and they're challenging that, and the people who don't favor environmental regulations have seen this as the ideal case to take down the Chevron doctrine. What is your take on that, and how do you plan to respond if it goes the wrong way?
Yes, so for the Zoom folks, the great question was, there's a Supreme Court case, ostensibly over fisheries, but actually over something called the Chevron Doctrine, that could potentially end a long-standing practice of deferring to federal agency expertise. So if Congress passes a law that doesn't exactly say what the federal government does to implement it, gives them some latitude, and then the federal government, using its agency experts, sets a regulation, the practice has been to, in cases of ambiguity, defer to the agency to say, you have the experts, you interpreted the law. That has really helped with environmental regulation because, as you can imagine, it's not feasible for Congress to specify exactly what EPA has to do when they're setting science-based or technology-based pollution standards. I think the implication of the question was that that case might not go our way. That is unfortunately also a concern that I have. So a couple of things. One, the Lung Association actually worked with several other public health and medical groups to do an amicus brief, a friend of the court brief on the case. We opted not to highlight environmental regulation. We didn't think that given the audience of the court that might be compelling. But instead we highlighted issues with CMS, with Centers for Medicare and Medicaid Services, because again, requiring that Congress legislate extremely technical details could have far-reaching implications beyond the environment. It could really gum up the works of a lot of things, and that's what we highlighted in our brief. I think I would say I'm nervous about it, and it also has meant that, at least at Lung, we've really pushed hard on some of the things that we think are safest from a legal perspective. So the soot standards, that is something that the Supreme Court has litigated on. There's been plenty of cases over it, and it is about as tried and true EPA authority as it gets. Things that use existing authority to ratchet down on pollution limits as opposed to charting new novel ideas for how to use the law, we think are less vulnerable. So we certainly don't think everything we do will suddenly be vulnerable, but it's definitely a cause for concern. I don't know if that answers the question about what we do about it, but
Yes, we have an online question. It says, when the ambient air coming into an environment, for example, fires, is above the goal of 25 micrograms per meter squared for 24-hour periods, what happens as there will be a widespread violation of the target goals?
So the question was, if a place has wildfire smoke that causes it to exceed those new pollution standards, what happens from a regulatory perspective? What happens from a regulatory perspective is that doesn't count. Under the Clean Air Act, communities that are not meeting those air standards, actually the state working with them, has to write a plan for how they'll clean up. Wildfires are exempted typically, along with other natural exceedances as exceptional events. And so they don't typically count toward whether a state is violating the standards or not, or whether the air in a state is violating the standards. Now, as we all know, wildfires are increasingly not entirely unhuman caused. There is obviously an impact of climate change, but right now that's how the law is written. And so while those days are bad for your lungs, they don't count for whether a state has to clean up its air. I think you were next.
Can you hear me?
Yeah.
All right. So as a pediatrician, I was really excited to hear about the child-specific report that's coming out, I think in relation to EVs and lung health. I was curious if that's also going to include the increased efforts to electrify school buses. I know there's many people here who've been working on that, and to take into consideration some of the unique calculations of children's health from school bus travel. And if there's more and more school buses that are electrified, does that data go into this report as well?
So the short answer is it does not reflect the current trends in school bus electrification. Oh, sorry. The question was about whether the new report will include school bus electrification. It doesn't dive specifically into them. It doesn't note them. But because our original modeling essentially has an ambitious but achievable trajectory of getting to zero emission heavy duty vehicles, that's kind of already baked in. And so the current trends in school bus electrification are more, yes, we're actually getting there. Like this is, a key piece of getting to that future.
Right. Given how dysfunctional Congress is, it makes total sense for us to be focusing on EPA regulations. And I know that the ALA is going to be bringing a number of us to Capitol Hill tomorrow to talk about EPA regulations. But for those of us who aren't going to the Hill tomorrow, could you talk a little bit about how people here in this room can contact their Congress people to have some impact on EPA, because it's not a direct line.
It's a great point. Yes, so how can people not participating in Tomorrow's Hill Day, or in addition to participating in Tomorrow's Hill Day, reach out to their members of Congress to support these regulations? So number one, for the regs that aren't out yet, Congress plays an outsized role. I will say, off the record, that I would imagine that on a tricky issue, it would be helpful for the Biden administration to hear from a swing state member of Congress that they want to see it. Conversely, it would be very bad if they heard from a swing state member of Congress that they didn't want to see it. And I'll be frank and say that, at least with the SIT standards, we know that our opponents on these standards are organizing against us. We know that they worked really hard to get voices in opposition to the standards that they thought the administration would listen to. And I'm sure they're doing it on the other ones. So particularly if you live in a swingier place, this is particularly if you have swingier members, although I know they're fewer and farther between, asking them to ask the administration to get them across the finish line, or not ask them not to get the administration to get them across the finish line, is really helpful. And then second of all, as I mentioned, Congress has a path, the Congressional Review Act, to nullify regulations. So once something has been finalized, even if it's safely outside of the danger window that I described earlier, it's still not great for future air regs when Congress, passes show legislation to overturn it, or passes amendments to other things to overturn it. So even if there's not an immediate threat from Congress, because we know President Biden would veto them voting to overturn something now, the more votes that they have on that, the worse it is for EPA's willingness to go out on a limb and do future clean air protections. So it is completely reasonable to ask your members of Congress to vocally support these standards. It's also reasonable, if you think the audience makes more sense this way, to ask them what they're hearing, have a chance to put them in touch with folks who can push back on any of the talking points that they're hearing against the standards. And, if they don't want to tout it, ask if they'll stay silent. I think you were next, but tell me if I'm wrong.
Hi, I was just wondering if you could comment on the, I don't know if you call it a clause with the proposed power plant rule regarding hydrogen, and what types of hydrogen might be considered clean.
Yeah, I can comment
Update
on
us
what
on
we
that.
want. So certainly the Lung Association shares, I think, a lot folks here's concerns about the build out of hydrogen. Is it just going to be a replacement for, a way for the fossil fuel industry to entrench itself? We're concerned about it. We have less technical chops on this issue than some others. So, I won't pretend to be the expert on how EPA is going to go with the final rule, but we are definitely on the record calling for hydrogen to be green, and for it to meet certain criteria to make sure that it's not, number one, just using more fossil fuels in a different way, and then number two, that it's not cannibalizing clean energy that would have already gotten used for something else. It needs to actually add. But whether we see EPA finalize that, I don't know.
Yeah, this is in response to the woman's question about what can we all do to work with EPA if we're not exactly going to the Hill to lobby. So my name is Clark Reed, and I work at the EPA. And I work in the Voluntary Energy Star program. And I, for the last 25 years, have been working with hospitals to make them more energy efficient and decarbonize. And if you take out your phones and go to energystar.gov, and there is a menu up there that says partner resources, and then join. You can join as a healthcare system, as a hospital, to join the Energy Star program. And through this free voluntary program, we'll help you decarbonize by becoming more energy efficient. You may have heard an earlier question that I had to Lauren earlier about the certification of buildings. Just like we certify 75 different consumer product categories, we also certify entire buildings. 41,000 buildings have been certified as Energy Star, and they use 35% less energy than typical buildings, and they emit 35% less greenhouse gas emissions. We also have, of those 41,000 buildings across the country, 410 of those are general medical and surgical hospitals. If you are in a healthcare system and you're wondering, how am I going to decarbonize? Goal number one is to get it Energy Star certified, and we can help. So just another way to work with EPA, and I would probably be that person that we would be working with, that you'd be working with. So the question was, is Energy Star certification only for US hospitals? And unfortunately, yes. The standards that you are compared against are US based. However, if you are in a hospital or other building across the country, you can benchmark in our free tool called Portfolio Manager. It's just that we won't be able to recognize you at the EPA. So sorry about that, but
No.
I just thought, boy, this is too hard to just sit there and pass up. So
No apology needed. I love it. Thank you. I think final question probably. Yeah.
For the soot rules, I was just curious, like in our state, most of the soot pollution is non-point source transportation pollution. What are some ways that states will write their plans in order to reduce that, that's beyond the other regs that you're going for?
Question, how will states who most of their particle pollution or soot is coming from motor vehicles write their state plans to clean up? I actually am happy to follow up with you offline because we can dig into a bit more details. Short answer is menu of options. Vehicle inspections often come up for a lot of the communities in non-attainment, but there is a menu that EPA requires depending on how much you're violating the standards by, and then some additional options. So I can follow up with you. I will close by, first of all, saying, if you want one more opportunity to take action, here's the lung associations. This is our petition. Don't delay clean air today. This has our to-do list. We update it every time one of the to-do list items gets checked off. So right now, this is both a thank you on particle pollution and an ask for the rest. You'll also hear more from Climate Action Campaign folks and from Liz later today with an additional thank you. Please do that one too. And then finally, we're here to help. I love learning from this group and I'm always happy to get feedback and suggestions and just have an opportunity to talk further. So thank you so much. Look forward to staying in touch.